So today we will take microbiology. Now the very first question is about a nurse who has spilled a blood sample on the floor. Now what is the best disinfectant in such a case? So please remember, for all blood spills, the best is 1% sodium hypochlorite. Clear? So this is the best disinfectant for blood spills on the floor, especially in the wards. Right? Then moving forward to another question where it has been asked about the process, which is like for a transfer of information from the nucleic acid chain to mRNA. So this is as discussed in the central dogma, from DNA to mRNA. If the information is passed on, that process is known as transcription. Clear? So this is transcription. And in some viruses like retroviruses, especially HIV, we can see that mRNA is acting as a template for synthesis of DNA. So the reverse is happening. So we will call it reverse transcription. Clear? So transcription and reverse transcription. If the mRNA is found from DNA, that is transcription. If the reverse happen, it means the DNA is being found from mRNA, that is known as reverse transcription. And this is the property of retroviruses, especially HIV virus. So this is transcription, reverse transcription. Now the synthesis of proteins from mRNA, it is known as translation. So this is known as translation. Clear? So this is translation. So transcription and translation and reverse transcription. Now there is one process, and that is known as DNA replication. Now replication means to make copies, right? So it means from one DNA there will be many copies of other DNA molecules. So that is known as replication. Clear? So this is replication. So these are few terms which you should know: transcription, reverse transcription, translation and replication. Clear? So here we can see that from DNA there is synthesis of mRNA, and this is known as transcription. And from mRNA there is formation of the protein chains. So this is the protein chain, and this is known as translation. So here we can see these are all amino acids. Clear? So these are all amino acids, and these amino acids are joined by the peptide bonds. So these are the peptide bonds, and this is known as polypeptide chain, right? So these are the peptide bonds. Fine. So these are few terms which one should know. Then moving forward, a chest physician was doing bronchoscopy in the OPD, and then since there are many patients, so every time he need to sterilize the instrument. So what is the best way to sterilize the instrument? And especially in OPD setups where we have to quickly sterilize the instruments, especially the scopes. It can be endoscope, bronchoscope, proctoscope. So all these are best sterilized by 2% glutaraldehyde, that is also known as the Sidex. So this is 2% glutaraldehyde, also known as Sidex. Clear? So especially in OPD setups, when we have to quickly sterilize the instruments so that they can be used in other patients as well. So this is the Sidex solution here. Clear? So this is the Sidex solution. Then moving forward, an antigen was administered for the first time to an animal or a human who has never been exposed to it. What will be the first antibody to develop? Now, the moment you find the word first in terms of immune response, always think of IgM. Clear? So, this IgM actually mediates the primary immune response. It means there is the very first exposure, and this immune response is time taking. It takes some time to generate the immune response. So it is time taking, and this is the primary immune response. And then there is immunological memory. This immunological memory makes sure that if there is same agent which has been exposed again, so if there is same agent exposure, then there is generation of the secondary immune response. And this secondary immune response is very quick. So this is very quick, and this is generated by IgG. So for primary immune response, which is the very first exposure, clear? So this is the very first exposure. Here the immune response will take some time, and this is mediated by IgM. Whereas if there is subsequent exposure by the same agent, there will be secondary immune response which will be very quick because of immunological memory, and this is generated by IgG. So primary immune response and secondary immune response. Then moving forward, a very basic question which has been asked many number of times. A patient was having bee sting, and then he developed hypotension, edema, and breathlessness. Now, this is a classical case of anaphylaxis. Clear? So, after bee sting, there is hypotension, edema, breathlessness. So, this is anaphylaxis. And here, the immune response is mediated by IgE. Clear? So, in allergic, anaphylactic, this is IgE. Right? Then moving forward, a child developed bloody diarrhea, and it was suspected that this infection has been caused by E. coli O157 to H7 strain. Now, when we are suspecting this E. coli O157 to H7, what culture media we need to use to isolate this organism? Now, to answer this, for O157H7, you can remember SMAC. Right? So please remember SMAC. Now, S is for sorbitol and MAC is McConkey. Clear? So this is sorbitol, and this is McConkey agar. Now, why we are using this SMAC here? Because the E. coli 157H7 is non-sorbitol fermenter. Clear? So this variant of E. coli is non-sorbitol fermenter, but other variants of E. coli are sorbitol fermenters. So this is how we can differentiate whether in the stool sample it is E. coli 0157 to H7. Good evening, Yashwant. Good evening, online. So these all other variants are sorbitol fermenters. Clear? So we will go for SMAC. So here you can see the non-fermenters and the fermenters of sorbitol, McConkey, agar culture media. So we look for sorbitol fermentation in SMAC medium. Clear? So this is SMAC for especially for E. coli 0157 to H7. Clear? Then moving forward, which organism causes scombroid fish poisoning by releasing histamine? Now here you have to remember a couple of terms. One is of course the Proteus, and second is the, so one is Proteus morgani, okay, so this is Proteus morgani, and the second one is Enterobacter aerogenes. Now here what they do, they have an enzyme that is known as histidine decarboxylase. So the enzyme is histidine decarboxylase, and this is actually enzyme needed for formation of histamine. Clear? So this is the enzyme which is needed for production of histamine, and these bacteria, they have this enzyme, so they produce histamine. And this scromboid fish poisoning is especially seen with the eating spoiled fish like the tuna, mackerel or sardine. Clear? So this is scromboid or histamine poisoning, especially seen with Proteus morgani and Enterobacter aerogenes. Clear? So especially these two bacteria you have to remember. So Proteus morgani and Enterobacter aerogenes, and they act by releasing histidine decarboxylase enzyme which is needed for production of histamine. So this is how this question has to be summarized. Clear? Then a very favorite questions and has been asked many number of times. A child has a grayish membrane in the oral cavity and which bleeds on scraping. Now what is the diagnosis? I think the moment you have a case history of a child who is having a membrane in the throat, classically the diagnosis would be diphtheria, right? So this is a classical diagnosis of diphtheria. So here you can see the membrane in the throat. Clear? So this is the membrane in the throat. So classical of diphtheria. Online, like at this moment of time, it is always a wise decision to revise PYQs, because theory you would not be able to, revise the entire theory thing. So better is like you just go with PYQs as much as possible. And Yashwant, for ophthalmology and surgery, I would say yes, you can just go for PYQ because it's hardly 8 to 10 days. So it's better just go with the PYQ bank as much as possible, right? Now, a 20 years old male present to the STD clinic with painful genital ulcers, right? And the gram stain shows gram-negative coco bacilli. Now here you have got two important things: painful genital ulcer and gram-negative coco bacilli. Now when we study the genital ulcer diseases, we usually take into consideration three entities. One is syphilis, second is chancroid, and third is LGV, lymphogranuloma venereum. But this disease never presents with ulcer, because by the time the patient notices the disease, the ulcer stage has already gone. So never presents with genital ulcer. The patient always comes with enlarged lymph nodes. So this can be excluded here. Now, syphilis presents with genital ulcer, chancroid presents with genital ulcer. And the classical difference is this is painless and chancroid is painful. So just getting this particular word, painful genital ulcer, the answer has to be chancroid. And yes, the gram stain is also confirming this, because this is gram negative cocobacilli, right? So the condition which we are discussing in this given question is the chancroid, okay? So it is the chancroid here. And chancroid is caused by Haemophilus ducreyi, and Haemophilus ducreyi is grown on chocolate agar with isovitalex and vancomycin. Clear? So this is chocolate agar plus isovitalex plus vancomycin. So this is the culture media for Haemophilus ducreyi, which is the causative agent of chancroid, which presents with painful ulcers. Clear? So this is how you can read this question. Then moving forward, a patient is having pneumonia. And when sputum examination was done, it was showing gram positive, branched organism, strict aerobe, and more importantly, partial acid fast. So here we have to think of a causative agent of pneumonia, which is gram positive, but at the same time showing filaments. Strict aerobe means cannot grow without oxygen, right? Cannot grow without oxygen. And partial acid fast means it will show pink color on Ziehl-Neelsen staining. So partial acid fast. Now this all description suits Nocardia. Clear? So this is all very suggestive of Nocardia. So Nocardia is aerobic, gram positive, filamentous, that is branching, and partial acid fast. So this all description suggests Nocardia. So right. So please remember this. All these features of Nocardia, a causative agent for pneumonia. Right. Then moving forward, which bacterium shows safety pin appearance? Now this you must have read many number of times. So safety pin is something like this. So the bacterium, they shows bipolar staining. So this is bipolar staining, and this is especially in terms of Yersinia pestis. So one has to remember at least Yersinia pestis, which shows this bipolar staining on right stain. Apart from Yersinia pestis, there are certain more bacterium which will show you this safety pin appearance. One is Vibrio parahemolyticus, then Burkholderia mellii or pseudomellii, Haemophilus ducreyi, and Klebsiella granulomatis. Right? But the important one is Yersinia pestis. So please remember this bipolar staining of Yersinia pestis, which is especially seen on right stain. And I think, yes, most of you must be knowing that Yersinia pestis causes plague. Clear? So this is bipolar staining or safety pin appearance on staining. Then moving forward, a very important thing, like Gonococci can be differentiated from Meningococci by which sugar fermentation test? Now there are two sugars, glucose and mannose, right? So remember G for G here, right? So glucose is only fermented by Gonococci, and the other sugar, maltose, is also fermented by many. So this is common for both, and remember additional M here. So this is maltose. So glucose plus maltose, Meningococci, and only glucose is Gonococci, right? So this is one important term here, and you can remember G for G, and here apart from G you have to remember M also. So M for maltose, right? So this is one way. Apart from this, there is one more difference, and that is about the shape. So Gonococci, you can write G something like this, and Meningococci you can write M like this. Now the shape of Gonococci is like this. So this is known as kidney shape. So adjacent surfaces of Gonococci are concave, and that is known as kidney shaped, but the adjacent surface of Meningococci are flat. So this looks like half moon. Clear? So it is something like this. So because both are diplococci, so you can remember it like this. Clear? So this is one more difference between the two. This is half moon for Meningococci and kidney shaped for Gonococci, right? So this is Meningococci is half moon shaped, and the Gonococci are kidney shaped. Clear? So here the adjacent surfaces are flat. You can see the adjacent surfaces are flat, and here the adjacent surfaces are concave. So this is one difference in terms of their appearance, right? Then apart from this, other differences which you can understand, like Meningococcus is capsulated, whereas Gonococcus is non-capsulated. Then Meningococcus can be seen within the cells or outside the cells, but Gonococcus is always within the cells, right? So this is intracellular, within the cells. Clear? And then I think the condition which are caused is Meningococcus will cause meningitis, and gonorrhea will cause gonorrhea, that will present as urethritis and cervicitis in male and female respectively, right? So these are few differences which you should remember. Of course, one is in terms of their shape, and second is in terms of the sugar which they ferment. So Meningococcus will ferment both the sugars, glucose and maltose, whereas Gonococcus will ferment only glucose. Clear? Then moving forward, a child has high-grade fever with sore throat, and a membrane was observed in the throat. Now, what medium is needed to make a final diagnosis? The moment you have a case history of a child with a membrane in throat with high-grade fever, always think of diphtheria. So that should be your first diagnosis, diphtheria. And for diphtheria, we use two culture medias. One is Loeffler's serum slope, and second is potassium tellurite agar. Clear? So just remember these two culture medias for Corynebacterium, Diphtheria, which is the causative agent of diphtheria, right? So loft-close serum slope and potassium telluride agar. Then a patient of acute lymphocytic leukemia is having fever, neutropenia, and was given antibiotic. Now, after giving antibiotic, he developed diarrhea. Now, which organism is responsible here? Now, after antibiotic therapy, if a patient develops diarrhea, this is suggestive of a clinical condition that is known as pseudomembranous colitis. Clear? So this is pseudomembranous colitis, and pseudomembranous colitis is caused by Clostridium difficile. Clear? So it is caused by Clostridium difficile. Now here in the question it is given amoxicillin. It can also be seen with third generation cephalosporins. Clear? So if the antibiotics are given for prolonged period of time, it can lead to pseudomembranous colitis, which is caused by Clostridium difficile. So the classical precipitating factor is long-term antibiotic therapy, and the clinical condition is pseudomembranous colitis. Clear? So this is Clostridium difficile. Then moving forward, which organism cannot be grown on artificial culture media? The answer is very straightforward. This is Mycobacterium leprae. Clear? So the organism which is the causative agent for leprosy, and here since it cannot be grown, so it does not fulfill Koch's postulate. Clear? So this is the one which does not fulfill Koch's postulate, and it can be maintained on foot pad of mice or 9-banded armadillo. Clear? So it can be maintained on 9-banded armadillo or foot pad of mice, right? Otherwise it cannot be grown on artificial culture media. So this is Mycobacterium leprae, causative agent of leprosy, right? So it is acid fast, not grown in vitro, that is cannot be grown in artificial culture media. Then it affects skin and peripheral nerves. Clear? Then moving forward, a patient comes with complaint of fever, neck rigidity with neck pain, and this is suggestive of meningitis. Clear? So this is suggestive of meningitis, and for meningitis we will do CSF analysis after doing lumbar puncture, and what we are getting here, cobweb, low sugar and high proteins. Now the moment you get the word cobweb formation, straight away you can make your answer as tubercular meningitis. Clear? So this is tubercular meningitis. Sugar is always less, proteins is always high, and if you go for cell analysis, there will be raised lymphocytes. Clear? So this is tubercular meningitis, TBM. Now this is cobweb. If you, instead of cobweb, if you find turbid with increased neutrophils, the answer would be pyogenic meningitis. Yes, Aditi, you are absolutely right. This is TBM, that is tubercular meningitis. So the cobweb formation is classical here. Then moving forward, a patient with high-grade fever, have headache, vomiting, and knuckle rigidity. So again, this is a classical case of meningitis. And when we did CSF analysis, we found growth of lanceolate shaped diplococci. Now, which organism is this? Now here, lanceolate means blunt at one side, pointed at other side. And diplococci, like two bacterium together. So this is the classical appearance of Streptococcus pneumoniae. Clear? Which is also known as pneumococcus. Clear? So this is a classical description of Streptococcus pneumoniae, which is a lanceolate shaped diplococci. Clear? So if we see here in the image, it's a gram positive, of course, and one end is broad or rounded and other end is pointed. So this is known as the lanceolate or flame shape. So here we can see the organism with a lanceolate shape or also capsulated. Clear? So this is lanceolate, and the moment you get this particular description, the answer has to be pneumococcus. Then moving forward, a 5-year-old child presents with cough, running nose, conjunctivitis, and the physician noticed that there are small white lesions in the oral cavity, and then there was a rash which started on the face and then covered the trunk of the body. Now here there is a child with cough, running nose, conjunctivitis, but what is more important here is small white lesions inside the oral cavities. Now inside the oral cavities, white, very good Rizwan, very good. So this is nothing except a classical description of Koplik's spots. So the moment you have any description related to Koplik spots, which are actually in the oral cavity opposite upper second molar, which is actually the site of opening of Stensen's duct as well, straight away you will go on to the diagnosis as measles. Right? So there is a child with Koplik spots, then rashes, straight away. Yes, Aditi, absolutely right. So this is a classical description of measles. So here we can see the Koplik spots. Right? So these are all Koplik spots. Clear? This is how you will identify the Koplik spots. Right? Moving forward, a patient comes with complaint of multiple episodes of loose watery stools for 3 days, and then there is a past history of ingestion of shellfish in a restaurant, and then other people who consumed shellfish also developed the same symptoms. Now what is the viral cause of this presentation? Right? So diarrhea after ingestion of shellfish, always think of one virus, and that is norovirus. Right? So always think of norovirus. So this is the virus which is implicated in causation of diarrhea after consumption of shellfish. Clear? So this is a classical case history for shellfish. Now a patient working in ICU develops fever with loss of smell. Now what need to be done? If you remember, this was one of the characteristic features of COVID-19 infection, loss of smell. Then of course fever, working in ICU, so must be getting in contact with some patient who was admitted with COVID-19. So this is COVID-19, and for COVID-19 the best is RT-PCR from the nasopharyngeal swab. So RT-PCR here. Very good. Rizwan, Aditi, very good. Now, causative agent of Condyloma acuminata. Now here you have to remember two terms which starts with condyloma. One is, of course, acuminata, and second is condyloma lata. Now, acuminata means spines. So here the lesions are projecting like this, and this is a condition which is caused by human papilloma virus, right? So acuminata is a viral condition, and condyloma lata, it is seen in secondary syphilis. Clear? And these are actually moist lesions in the perianal area. So these are moist lesions. So please remember the difference between condyloma acuminata and condyloma lata. Both are separate entities. One is viral and another is bacterial. Clear? So don't mix up, and this is what is the purpose of this particular question. So here you can see this is condyloma acuminata. Clear? And this is condyloma lata. Fine? So please make sure you don't mix up. Then moving forward, a patient has history of jaundice for 10 days, and his LFT shows bilirubin which is increased, then enzyme levels which are increased, and alkaline phosphatase also increased. But what is more important here is the very good Rijwan. Yes, that is 6 and 11. Yes, I'll write it here. Thank you. So HPV 6 and 11. Thank you. Right? So what is more important here are the viral markers. Now the patient is positive for hepatitis B surface antigen. So this is positive. Clear? So this is confirmed that this patient is having hepatitis B infection. Clear? And that is evident by jaundice and raised liver enzymes and raised bilirubin as well. Now we want to establish acute hepatitis B virus infection. So apart from this surface antigen positive, for acute we will always go for IgM HB core antigen, right? So this is antibody to core antigen, right? So this has to be positive, then only you will say that this is a case of acute hepatitis B virus infection. So surface antigen, so this is surface antigen which has to be positive for hepatitis B virus, and antibody to core antigen. Clear? So please remember this is antibody to core antigen, because core antigen is never seen. It is only the antibody which is seen, and that too is specifically IgM. Because if you get IgG, then it's just chronic infection. Clear? So make sure you don't mix up. This is a very important segment. Always and always we have a question from here. So surface antigen positive and IgM type of antibody to core antigen positive. This is what is suggestive of acute hepatitis B virus infection. Clear? So this is how you need to diagnose it clinically. Then moving forward, and I have kept one more question here. So patient is surface antigen positive. The patient is IgM antibodies to core antigen, and the patient is also having hepatitis B envelope antigen. So if we just write it down, surface antigen, this is positive, right? Then IgM antibody to core antigen, this is also positive. And then envelope antigen, this is also positive. Clear? Now, what does this indicate? Now, here we just discussed that if these two are positive, this suggests acute hepatitis B virus infection. Clear? And if envelope antigen is positive, it suggests infectivity. It means the patient is highly infectious. So what you will write? Acute hepatitis B infection with high infectivity. The patient is very infective. He can transmit the infections to unimmunized people or the relatives, right? So this is how you need to get your answer. Considering 1 and 2, you can say this is acute hepatitis B virus infection. Considering the third fact, you will say this is with high infectivity. Clear? So this is how you need to organize the viral markers. Moving forward, a very basic question, sphagetti and meatball appearance. Now this is related to Malassezia furfur, which is the causative agent for tinea versicolor. Clear? So this is the causative agent for tinea or pityriasis versicolor. And how we see it actually? So these are the meatballs, and here in the image you can see these rounded forms which are compared with the meatballs. Okay, so these are the meatballs here, and this is sphagetti. Clear? And the sphagetti is these like these all here, something like this. Okay, so this is how you will sphagetti and meatball appearance. Clear? So this is the classical picture of pityriasis versicolor, and the causative agent is Malassezia furfur. Then moving forward, a patient was having some fungal infection, and when staining was done, there were sclerotic bodies which were having muriform cell appearance. Now, what is this? The moment you have this word, sclerotic bodies or copper coins or copper pennies or muriform cell appearance, the classical answer is chromoblastomycosis. Clear? So this is chromoblastomycosis. Right? So just look for this word, copper pennies or medlar bodies or sclerotic bodies. Now how does they look like? Now what you will see here, there is a brown body, and in that you can see transverse septa. So you can see these transverse septa. Clear? And the color is brown, and therefore they are compared with copper coins. So these are actually the sclerotic bodies or medlar bodies of chromoblastomycosis. Fine? So the moment you see anything brown colored, copper colored related to some fungal infection, if you don't know the answer, it's better to mark the answer as chromoblastomycosis. Clear? So that is enough for this session, and I am really thankful to all of you for sparing your valuable time. Very shortly I'll come with another subject. Till then, study well. God bless.